This episode of Precision Opinions Live is brought to you by Vintage Labs. Vintage Labs is a professional-grade supplement and cosmetic company where each product is tested and reviewed by one of their exclusive pharmacists. Look for the pharmacist's signature on every package that ensures that the active ingredient falls within 5% of error and does not contain arsenic, lead, cadmium, or mercury. We welcome you to join the Vintage Labs collection, where they do the research for your health. Use promotional code LIVE, that's L-I-V-E, to receive a 10% discount on all orders at vintagelabscollection.com.
Precision Opinions Live. My name is Christian Stella, Pharm D, and today I am here with Naomi Nikfarjam.
Hi.
Thank you for coming on.
Thank you for having me.
Thank you for being a terrific student and really grasping the whole compounding unit. So you we're working at Walgreens, right? You still are?
Yes, I still am.
Still are at Walgreens.
Yeah.
You're at St. John's, Pharmacy Candidate 2022.
Yes.
And right now you're doing your rotation here. Didn't really know much about compounding before this.
Nothing.
Now, superstar, making about 15 creams a day, which is fantastic. So thank you for coming on. We discussed a bunch about hormone replacement, yeast infections, bacterial vaginosis, and we know we wanted to stay in the OBGYN area in that space, site of interest. So there's one formulation that we use quite often here, and it's called Yi2, Yeast Infection 2. That's our second edition of the yeast infection formulas, and it's fantastic. So we're gonna just go through that formula and kind of educate the patients on it, because we use it quite often here. So it's just to wrap it up, it's a combination of Clotrimazole, Boric Acid, and Lactobacillus in a suppository. So let's talk about each active first. First is Clotrimazole. Yes. Explain it.
So this is basically an antifungal. With a yeast infection, there's an overgrowth of fungi, which is why you'd want to use this antifungal in a preparation to help treat this.
Simple. Very simple. We have a fungi, we're trying to kill it. That's it. Boric acid.
Okay, so boric acid obviously has the word acid in it. It's to level out the pH and make it more acidic, to create a more acidic environment.
So yeast grows at a basic environment, which is a higher pH. So what we want to do is we want to insert an acid to lower that pH and kill off all of the fungi and kind of change the pH in that area. The other one. Okay. What is that?
So for the Lactobacillus, it's the probiotic, which is used as kind of like a preventative measure to help restore the good bacteria in the gut, all good health, and just promote that.
Exactly. Just like the gut has good and bad bacteria, the vaginal canal has good and bad bacteria. So we want to replace the bad with the good, and that's exactly what we're doing. So the formulation's essential because it has your three actives, one for prevention, one for prophylactics, and kind of just overall just takes care of every single area of a yeast infection. Now, side effects.
So some side effects you may experience could be irritation, some vaginal burning. Those are two most popular side effects.
Definitely. So vaginal burning, anything you're inserting vaginally could cause irritation. If patients have irritation, what we'll do is we might switch them to a different base sometimes. We would use a coconut oil base, which is completely smooth, soothing, if they have irritation. And what about refrigeration? We're refrigerating this, correct?
So being that it's a suppository, you should keep it refrigerated to keep the integrity of the product. And then when you want to insert it, you just kind of like rub it in your hands to kind of bring down the temperature a little to like a warmer temperature.
Exactly. And also, before you insert, you don't want it to be so cold. So you tell the patient to let it sit for 10 minutes. I do want to let the patients know, and I tell them every single time, the active ingredients, all 3 of them, do not need to be in the refrigerator at all. The only thing that needs to be in the refrigerator is the base to stay hard. It could be out of the refrigerator, it will stay hard, but if it's out for 48 hours, it will melt. So we don't want that to melt. It has nothing to do with the active. So the patients think that the active may spoil, but that's not the case. What about sexual intercourse?
So when patients are on this, we recommend they don't have sexual intercourse an hour before or 2 hours after using this product. And then also with boric acid, it is extremely toxic when taken orally. So it's important when taking this medication to refrain from any type of oral sex.
Exactly. Boric acid is complete toxic. It can really hurt someone. So we want to refrain from that. I would say I'm pretty much think that that's an overall view and a nice wrap up of the Yi2 formulation. It really is a nice formula for any sort of yeast, and it's very, very affordable for patients. It could be anywhere from $30 to $50, depending on the regimen that the doctor's prescribing. So Naomi, I just want to thank you for coming on.
Thank you. Thanks so much. It was so fun.
All right. Hello, this is Christian Stella from Precision Opinions Live. Please subscribe to our YouTube channel and like our social media links. You can reach us by email at compounding@precisionpharmacy.net or our phone number 516-785-4774, extension 2 for compounding. Thank you very much. Thanks for viewing.